Welcome back. We're continuing our series, What's at Stake? Today, we're taking on healthcare and just asking the question, what could Republican-controlled Congress mean to the landmark reform bill? Right now, let's welcome Sheryl Skolnick, who says that Republicans will likely take Congress and that the markets haven't paid enough attention to this quite yet. Sheryl's a healthcare analyst with CRT Capital Group. So, Sheryl, with healthcare reform, I mean, this legislation was thousands of pages long. A large part of it hasn't quite been digested just yet. So tell me, what parts might actually be tweaked? What might be repealed?
Okay, well, first of all, let's understand the landscape, Margaret. If the Republicans take the House and get control of the House, they still need to be able to get the Senate and the President to actually pass and then sign any legislation that they might propose. So we're actually calling for them to take the House. We say watch the Senate very closely, but we're actually expecting significantly increased gridlock given a Republican House and a potentially Democratic or split Senate. And in that case, while the House probably will pass a law after they're done with taxes and stimulus, they'll turn to health care to repeal and replace, as the platform suggests that they will. And we don't expect that to go anywhere. So in all practical matter, 2011 is not going to be the year in which health care is repealed. However, they can't repeal it. They certainly can starve it.
Right.
And the CBO estimates that $115 billion of the nearly $1 trillion proposed in this bill to be spent on covering the uninsured is actually subject to the appropriations process. And appropriations bills start in the House, as all spending bills do, and that's where the Republicans can exert control. They can effectively not put these measures in the bill. So, for example, the Long-Term Care and the Class Act certainly could be adversely affected by this. And then we have, in addition to that, the physician fee fix, which was a great deal of labor in the House and Senate over the summer, multiple attempts at getting it done. That expires at the end of November. So if there is a lame duck session, we would be a little bit worried about whether or not we're going to see significant disruption and potential for a 23% cut in physician fees. All of this as a result of a turnover of the House. But the key measure here is they can starve it. They can't kill it just yet.
Right. They can turn off the funding taps.
Yes.
But there are parts in there that don't mandate funding. What's safe?
Right. The parts that are safe are the exchanges. The parts that are safe are the medical loss ratio provisions. And at the moment, the parts that are safe include the individual mandate and the employer penalties for not enrolling either oneself or one employees in these plans. There is a move afoot to work on that mandate from a Republican perspective. That would mean to eliminate that individual mandate, and that's wrapped up in the court challenge that is moving forward in Florida to the law itself. That mandate really is key, and please understand that there are companies out there, not just hospitals, but also health plans, who are making business decisions every single day in trying to prepare for and organize themselves for these changes in legislation, changes in funding. For example, the Electronic Health Record Initiative, with promised subsidies in 2012, which the Republicans have said that they would eliminate. Businesses have spent money, they've hired people, they've made decisions, they've made investments on the premise that the government will be a consistent business partner. So these are very significant worries on the part of hospitals, on the part of health plans and physicians that are unknowns until we actually see what happens when the Republicans take control of the House.
No, it's an important part, and I'm glad you mentioned the electronic records bit of it as well, because we did see that investment in healthcare IT spending. We did see the immediate market reaction there. Your feeling, though, is that that could be in jeopardy?
Yes, it's part of the platform that this was part of the stimulus package, and the stimulus is something that the Republican Party platform generally would like to undo the parts of that it can. And they have, in fact, talked about eliminating these subsidies or paybacks. I prefer to call them paybacks for the investment that's been made to bring electronic health records to reality in the hospitals. It's, billions of dollars that are intended to be spent and intended to be subsidized. And it has moved a lot of things forward in the hospitals.
Yeah.
and the physician offices that wouldn't otherwise have happened.
All right. Well, we are going to be watching not only these elections, but what happens over the next 2 years of implementing some of these proposals and some of these things that have already become law. We'll see what the funding is like. Thank you very much.